T1. So just have a look. We can also do it into T1. Some of you are like T1, T2 rather than C7, T1. What we can do is ask a patient to slowly look to the right. Oh, you're stiff. And look to the left. Okay, so he's quite stiff on neck movement. Where does most of the motion come from in cervical spine?
AC joint and
Which joint?
C1, C2.
No.
AA joint, yeah?
AA joint and C7 and T1.
So the AA joint, so C1 will sit on C2. And then there's a pivot joint, so no disc. So then 50% of motion is coming from C1 and C2. So what that means is if you've got 80 degrees of rotation, 40 degrees C1, 2, and then the rest of the 40 degrees is coming from C2 to T3. So a little bit of each. Now, if you're blocked above and you're blocked below, the only bit that's moving is a bit in the middle. And you wonder why patients get C4, 5, 6, 6, 7 pain. So, yes, I do treat C4, 5, but not very often. I normally go below it and I normally go above it. So, before you have it done to you, just look left and look right and just see if you are restricted, if there's any discomfort. Have it done and see if it changes. It's not a neck manipulation, but it sort of is because it's a cervical thoracic treatment. So it's the base of the neck. If you did my advanced course, we do another 2 on this one. There's more positional stuff, okay, prone, different angles, yeah, and stuff like that. So this one's the straightforward, the safest one, where we don't use the neck as a lever. Can you sit back a little bit more? So remember, my patient's always to me, okay? You'll never see me go to them. Yeah?
Can you, sorry, Mike, from this side?
Yours that side?
Yeah, sorry.
He's obsessed.
It's precious, isn't it?
No, I want to have
I wish I had a haircut now on the tan.
Next week.
That's in a couple of weeks. Now, when you see people do this one, interlock your fingers behind your neck. This is what they start doing. This is what I don't like. It's not wrong, I just don't particularly like it. Because from here, I'd have to try to get one arm coming through, and it's quite stocky, okay, one arm coming through, so it's not the easiest to get myself into the position to start with. So what I suggest you try, let the arms go. So, and t-shirt stays on, okay, why? Because armpits, forearms, they don't particularly like the sweat on them, all right, so you never know where you are. You might be looking at the teams and they're sweating, okay, and I normally would say, put your top on for me to do this technique, yeah, because my arms are coming under. So from here, hands on the forearms, you see, interlock your fingers behind your neck, and there. Watch again. So come through, hands on your forearms, and say to your patient, interlock your fingers behind your neck, and you're already there. Keep the elbows in, because you protect the shoulder. Some people, therapists, this is let go. So use the arms as a lever. Try never to do this. It irritates the shoulder capsule. If you dislocate the shoulder, they won't like it. If you've got impingement, they won't like it. So keep the elbows in. Men, it's probably a little easier, but a woman possibly, because you can put your upper chest, if you like, onto her upper back. See that? For women, you might have to use a towel here. You don't have to. Try it and just see how you find it. Towel there, but I would normally just use my upper chest and use the firmness, if you like, onto that area, and that helps me almost use my chest just to mobilize the C7, T1. By changing the angle of the cervical will depend on whether you're going to do 7, T1, T1, T2, maybe T2, T3. So you can target different areas in here by changing cervical positioning. Let's do C7, T1, let's see what happens. For the majority of setup, it will cavitate. When I say majority, it's just above average, 6 out of 10. If it doesn't cavitate on the setup, then you're going to go with the mobilize into a thrust. Remember, every technique can be a mob. So if you're not sure about the insurance side and the money side, yeah, just go through the motion of the technique, and it's more of a mob. As soon as you start doing that separation, as in as soon as you thrust, you cross that line. You're in the different field. You have to get the insurance. Yeah, so just remember that. So you don't have to manipulate. You can do every technique and it can still cavitate, but it's not a manipulative cavitation. It's a mobilizing cavitation. And then that's the safest option. And when you start feeling more confident, competent, yeah, start to put a bit more of a thrust in. Yeah. and slowly you'll start to improve. So with this one, let's go for it. Interlock your fingers. I'm going to bring his elbows forward. Relax now. Like that. So I'm going to place my upper back, so upper chest on his upper back. There, see that? The couch is a little lower, which is good. So he is like below me, see that? So watch, okay, from there. So I'm going to rock him. Relax, like that. There. You see it went? Okay, not the loudest click, but it went just as a setup from there. The thrust would be, watch, from there, but it already went as I said. Set him up, okay? So, which is good, because as I'm setting him up, it's already clicking. Yeah, from there. I didn't have to do the pre-click. I could have just gone into a position and done it, and then it would have cavitated before. But at least if it goes as on the setup, you're not really left with much to do. The thrust, a lot of people change the thrust. The thing is, if I do it on someone else, I'm spoiling it. I don't mind doing it, but if I do it on you, then whoever's working on you, I've spoiled it, so it's not going to happen. But I can show it to you again afterwards. So from here, interlock, elbows forward, place your upper chest over, bring him back and almost just rock. Forward and back. And then just at the end, it's not, people think from there I do this or I do this. It's not really lift up, it's just a continuation of the same movement. From there, flexion, extension, so it's the same movement, just with a little applied thrust at the end. Chest draws in, I pull, there's a bind. Okay, so I've gone in and I've come out, but what I've done is as I come out, I feel the bind, then I thrust. It's not in and pull out, it's where it is, where she is, and there's a little overpressure at the end, which is the thrust. Works well. Yeah, so rotation of the neck. His neck is stiff anyway.